Welcome back to Healthy Lifestyle with Saira. In today's video, we are going to talk about iron deficiency in children, its symptoms, causes, and ways to treat. Iron is a nutrient that your child needs to grow and develop properly. But some kids don't have enough iron. This is called an iron deficiency. First of all, we need to know why iron is important for children. Iron helps move oxygen from the lungs to the rest of the body. It also helps muscles store and use oxygen. If your child's diet lacks iron, your child might develop an iron deficiency. The condition is a common problem in children. It can range from mild to serious. Without treatment, it can affect a child's growth and development. Sometimes being low on iron can leave the body without enough healthy red blood cells, which carry oxygen. This is a serious condition called iron deficiency anemia. Symptoms of iron deficiency in children. Too little iron can make it harder for your child to function well. However, most symptoms of low iron in children don't appear until iron deficiency anemia happens. If your child has risk factors for an iron deficiency, talk to your child's physician. Symptoms of iron deficiency anemia might include light pink skin color to the edge of the eyelids, lips, gums, or nail beds. Tiredness and low energy are also called fatigue. Shortness of breath during exercise. Cold hands and feet. Slowed growth and development. Poor appetite. Irregular rapid breathing. Behavior problems or more short tempered than usual. Frequent infections. Unusual cravings for things that contain few or no nutrients, such as ice, dirt, paint, or starch. Causes of iron deficiency in kids. There are usually four main reasons for iron deficiency in kids. Number one is poor diet. Children are at higher risk for iron deficiency because they need more of the stuff than adults do. And don't overdo the milk. A diet that features an excessive quantity of milk can place a child at risk for iron deficiency. Rapid growth. Kids' growth can be unpredictable and almost comically fast. If your child is in the middle of a growth spurt, they are going to need extra iron in their diet. Loss of blood. In some cases, blood loss is obvious, like when a child starts menstruating or sustains a serious injury. But it's also common for blood loss to go unnoticed. Inflammatory bowel disease, parasitic infections, and ulcers are just a few examples of conditions that can cause blood loss and, as a result, iron deficiency. Fourth reason for iron deficiency in children is inability to absorb adequate iron from food. This can occur with conditions like celiac disease or Crohn's disease. How is iron deficiency anemia diagnosed in children? In most cases, anemia is diagnosed with simple blood tests. Routine anemia screening is done because anemia is common in children and they often have no symptoms. The anemia screening with a hemoglobin blood test for all infants at 12 months of age. The screening should also include a risk assessment. This is a group of questions to find risk factors for iron deficiency anemia. Risk factors include feeding problem, poor growth, and special health care needs. If the hemoglobin level is low, More blood tests are done. If your child has a risk factor at any age, blood tests are done. Blood tests for anemia may also be done during routine physical exam or checkup in children at any age. Most anemia in children is diagnosed with these blood tests: hemoglobin and hematocrit. This is often the first screening test for anemia in children. It measures the amount of hemoglobin and red blood cells in the blood. Another test includes complete blood count, which is also known as CBC. A complete blood count checks the red and white blood cells, blood clotting cells, and sometimes young red blood cells. It includes hemoglobin and hematocrit and more details about the red blood cells. Another test includes peripheral smear. A small sample of blood is examined under a microscope. Blood cells are checked to see if they look normal or not. Another one includes iron studies. Blood tests can be done to measure the amount of iron in your child's body. Now at the end, I'll discuss how is iron deficiency anemia treated in children. Treatment will depend on your child's symptoms, age, and general health. It will also depend on how severe the condition is. Beginning at 4 months of age, infants that are only breastfed or partially breastfed should be given our daily iron supplements until they begin eating iron rich foods. Infants that are formula fed don't need iron supplements. The formula has iron added to it. Whole milk should not be given to infants less than 12 months old. Infants and toddlers from 1 to 3 years old should have food rich in iron. They include cereals that has iron added, red meats and vegetables with iron. Fruits with vitamin C are also important. The vitamin C helps the body absorb the iron. Iron rich diet. Eating a diet with iron rich foods can help treat iron deficiency anemia. Good sources of iron include iron enriched cereals, bread, pasta, and rice. Meats such as beef, pork, lamb, liver, and other organ meats. Poultry such as chicken, duck, and turkey. Fish, leafy green of the cabbage family such as broccoli, kale, turnip greens, and collards. Legumes such as lima beans and green peas. Dry beans and peas such as pinto beans. Black eyed peas and canned baked beans. This is all about iron deficiency anemia in children. If you like my video, please subscribe my channel, and for any health related question and query, you can ask in the comment section below. Goodbye.